Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
The topic today in Neighborhood Health Watch is menopause, why it matters, and all the people it affects. Menopause is a natural biological process that signals the end of fertility, but you can still stay healthy, vital, and sexual. Common symptoms are hot flashes, low energy, emotional changes, and trouble sleeping. And we have some people fanning already.
Yes, we do.
In the studio.
All of us.
Dr. Karen Knapp is from Henrico Doctors Hospital. She's joining us here today. Now let's talk about why it matters. I read some statistics that show by 2020 we will have 50 million women in this country going through menopause.
It's a lot of hot flashes.
Yes. How does that translate into treatment and care for women?
Well, I think just based on numbers, it helps the visibility so much. My patients come in, we baby boomers are used to our quality of life. The average age of menopause is 51. The average life expectancy is 83. So we're going to live 30 years of our life. And we're not going to want to live it having hot flashes and our quality of life impaired. On top of that, along with the menopause and aging, we're finding out that women age differently than men. So it's a really exciting time, and just the visibility and number of people involved and women engaged and talking about it really is bringing it to the forefront medically.
Now, menopause is not a disease,
No.
and it doesn't signal the end of anything, but
No.
what happens to the body?
Well, your ovaries, you're actually born with a biologic clock. Unfortunately, you really are. And your ovaries are set to self-destruct at a certain age. In my family, it wasn't until 57. Thank you very much,
Older,
my mother.
yes,
I know.
very good.
Didn't have my first hot flash till I was about 57. Thank you very
Awesome.
much. But it can happen before that. So, but you're right. The only thing that it's the end of is having to worry about being pregnant, which can be a real loss for some
Right.
women. But for most of my patients, it's a real freedom. They get
Does it ever end?
What?
For some women it does, and some women
What,
it doesn't.
their
But the
symptoms?
symptoms, yes.
You know, we would have told you before that, yeah, after about 6 months to 2 years, they would have been gone. But recent studies have shown that for a lot of women, it can really persist for a lot of years.
All right,
And we
Dr.
need to manage that.
Absolutely. Dr. Karen Knapp, thank you so
Thank you
much.
so much.